Pregnancy is a sacred and sensitive time in a woman's life. Her body is undergoing massive changes to support the growth of new life. Her physical and mental health becomes more delicate, requiring stability, care, and emotional support. During this phase, any risky behavior, especially engaging in sexual activity with someone other than the husband, can carry serious consequences. This article explains the real-life medical, emotional, and family-related risks involved when a pregnant woman engages in extramarital sexual activity. 1. Exposure to infections that endanger the baby. One of the most direct dangers is the risk of contracting sexually transmitted infections, STIs, such as HIV, herpes, syphilis, or chlamydia. These infections can easily be passed from mother to baby during pregnancy or childbirth. In many real-life cases, babies have been born with eye infections, respiratory problems, or even neurological damage because their mother unknowingly contracted an STI during pregnancy. Imagine a woman contracts syphilis during her second trimester. The bacteria can cross the placenta and infect the baby's organs, possibly resulting in stillbirth or lifelong disability. Such consequences are not just theoretical. They are documented in hospitals around the world. 2. Disturbed vaginal health leading to labor risks during pregnancy. The body maintains a fragile balance of bacteria in the birth canal. A new sexual partner may introduce unfamiliar bacteria, disrupting this balance. This can lead to conditions like bacterial vaginosis, increasing the risk of early labor or rupture of membranes. Many women don't realize that even if they feel fine, an undiagnosed infection can silently cause inflammation around the uterus, triggering contractions and risking premature birth. 3. Limited treatment options due to pregnancy in normal circumstances. Doctors can treat most infections with antibiotics or antivirals, but during pregnancy, the number of safe medications is very limited. For instance, certain drugs used to treat gonorrhea or herpes may be harmful to the fetus. So, if a pregnant woman becomes infected from an outside partner, doctors may struggle to manage her condition without harming the unborn child. 4. Emotional damage and mental health issues. Pregnancy comes with hormonal changes that already affect mood and emotions. Adding guilt, fear of being caught, or anxiety from an extramarital relationship can lead to deep emotional turmoil. Many women in such situations report insomnia, panic attacks, or depression. Research also shows that stress during pregnancy can lead to low birth weight and developmental delays in children. So, emotional pain isn't just affecting the mother. It directly impacts the baby's growth. 5. Family breakdown and uncertainty of paternity. Engaging in a sexual relationship outside of marriage during pregnancy creates trust issues in a marriage. If doubts arise about the baby's father, it can destroy families, create legal complications, and leave the child in an unstable emotional environment. In some real-life situations, paternity doubts have led to separation, divorce, or custody battles after birth. These family disruptions can deeply affect the child's emotional and psychological well-being. 6. Hidden illnesses and delayed treatment. Some women, out of shame or fear, hide symptoms of infection or complications after extramarital sex. This delay in seeking medical help can worsen the condition. For example, a hidden UTI can silently develop into a kidney infection, which can be life-threatening during pregnancy. 7. Impact on the mother-baby bond. Bonding begins during pregnancy. A peaceful mind, gentle touch on the belly, talking to the baby, these all enhance emotional connection. When a woman is distracted by guilt or anxiety, this bond weakens. It may even affect her interest in breastfeeding or bonding after delivery. Every woman deserves a safe and healthy pregnancy. Extramarital sexual activity during this sensitive time is not only emotionally complex but medically risky. The baby is innocent and completely dependent on the mother's decisions. This article is not written to shame or judge, but to inform and protect. If someone finds herself in such a situation, it is important to speak to a trusted doctor and seek support. Emotional counseling and medical care can prevent small mistakes from turning into lifelong consequences. In the end, the well-being of both the mother and the child must come first above all else.